Hey y'all, welcome to Keeping It 100, where we have these open and honest conversations and make sure you get all the information you need to make good health decisions. I am your host, Dr. Kristin Motley, and of course, another great show. Now, as you think of questions and want to make comments, please put them in the chat. My very, very good friend and best pharmacist I know, don't tell Dr. Thomas I said that, Dr. Renee Jones is behind the scenes, so she is going to make sure that you get all your questions answered. So thanks for coming through today, Dr. Jones. Dr. Thomas had to take the afternoon off, but let's bring in my amazing, awesome co-host, Mr. George Mink Jr., aka Georgie. How you living, G?
Hey, the street practitioner. You forgot to add that.
The street practitioner. How did I forget? The practitioner of the streets.
Right. Let's reverse it. But yeah, Doc, good afternoon. How you doing?
I'm doing good. You know, my little baby started daycare yesterday.
And little Noah.
Whole thing. It was a whole thing. I had to go to the principal office. It was a whole thing.
Oh, wow.
And I went back over there today to check on him, and it's another thing. And he just has a lot of allergies. So I need people to be on high alert all the time, all day long. And like, I just gotta pray a little harder.
Yeah, it's right. We're gonna be all right. I got faith in little Noah. So I think it's his mom is the problem, but it's all right. Haiti would cry, you did. So it's cool.
He is having a great time. Yeah. I'm over there causing all kind of issues, but we're gonna work it out.
It's all right.
So that's how I'm doing over here. But thank you for asking. Asking. Now you've been busy. I know that we did Chester Day Festival last weekend. I was in and I was out and I was back in, but tell me what I missed.
It was a beautiful day. I mean, I actually wish we could have a festival every day.
I know.
Like, I love when our folks come together.
Yes.
All the businesses, all the differences get left at the gate. Kids running around, food in the air, good music.
Yep.
Familiar faces. A great day. We actually didn't sponsor the vaccination that day. Of course, you know, we were just giving out information.
Yep.
We were basically an information table. And I enjoyed it. I talked to a lot of people. Got some good feedback from the community that we still need this, what we're doing, and, you know, still to get this awareness more like in everybody's faces and just never go away, pretty much like the virus. Yeah. And I had a great day. I think
we got a picture. We had a picture of you, Jada, and Ashley.
Oh, yeah,
so you and the girl, the intern.
The team, yeah.
That one was a good shot of y'all. I was like, look at my team. Y'all out there working. I love it.
COVID reset, the reset button.
Yes, hit the reset button. Oh, and look what I got for you. Oh, that.
Oh, you got the button. Oh, nice. Oh, we ready for Saturday. Okay.
We ready. I said, if I go to another event, I don't got George Button, it's gonna
be a problem. Oh, wow, that's real.
Okay. Amazon, bring this thing tomorrow. So it came through yesterday. So your button is in the place. You're gonna get some people to hit the button. Y'all hear that?
Bam. Nice. But yeah, Doc, it was a good thing. I mean, a lot of questions. One brother even asked, why should he still, you know, what's the purpose of still getting it if everything is open?
Wow. That's a good question.
Like, wow. Okay. Wow. He was like, why should I? I never got the shot. I never got COVID. Everything back open now. So, and I'm just like, really? So you still need protection though.
Yeah, absolutely.
Like that's even more of a reason to have protection. So.
Exactly, because everything is open. And that's what we're going to talk about today is like, what are the top reasons for getting the COVID vaccine? And so we're going to talk about that today. That is today's topic. But before we do, let me tell you what happened to me when I had left the Chester Day Festival. I went, set up, got everything straight, had to leave and get allowed to go pick up his car from the shop. And I went from one room in my house to another. And there was a door in the middle. Don't y'all know I hit my foot on that door jamb and I tore my pinky toe up. I went back to Chester Day Festival to pack up this stuff, went home, iced for the rest of the night, woke up on Saturday. I was like, oh yeah, my toe is good. I got out the bed and I was like, oh, my toe is not good.
Wow.
I ended up going to urgent care and found out that I broke my pinky toe.
Wow.
I broke my whole toe on Saturday.
I didn't even know that. Oh, wow.
Oh man, so I've been limping and pimping, and it's just been a
Wow.
whole thing. It's a whole thing. So that's why. So typically, me and George meet every morning, and we just have not met except for today because I just
Now I see why.
it's just too much. Between Noah going to school and I got a broken toe, it's just a lot.
Oh, that. Wow.
But nah, I'm good because we got 2 events on Saturday. So I'm gonna be limping my behind right through. We got a lot of vaccines to give. So lots of work to get done for sure. Now, I know you was out Monday and yesterday in these streets, the practitioner of the streets. Can you catch me up, please? We didn't really get the
I mean, as you know, I'm still outreaching. You know, it's never sleeps. The virus never sleeps, so neither should we. So I've been going around. I hit Chester heavy, and I talked to a lot of good brothers. I hit Collindale area, Sharon Hill. But one story like this really touched me is this brother that was from Chester, whatever. He said he'd been watching your show a little bit every now and then. But he started picking up, you know, when we got together, he liked the movement. You know, that's the buzzword. And
he
just said he watched the barbershop segment that we did with Kyle. And he said I really inspired him. I'm like, I really didn't say much. But he was like, you inspire me for me to get the vaccination, for me to have my wife get it and his kids.
Wow.
So he said, and then I ran into him again. And then he said it was a good thing because somebody in his family had got COVID like right after that.
Oh, wow.
And he said he felt good. And I'm just like, wow, you know, so.
Let me hit this.
Let me hit that button over there. Let me hit that button. So, I mean, that's what it's about, though, Doc. You know,
exactly.
You know, I appreciate you putting me on board, and that's what it's really about. The health awareness, the vaccinations is a big part of our duty now. That's how I feel. It's a part of our duty, along with everything else that we're trying to catch up.
Yep. So, let's reset and get caught up for sure. What a practitioner of the streets strikes again.
Yeah, you know, I'm undefeated right now. Like every week I'm scoring. So
you out here killing it. Yep. Yeah. That's what it's about. It's about training people up to make sure they have the knowledge and the understanding that they can take that information to the people that need to hear it and explain it in a way that people get it. And that's exactly what you do, George. You're really good at taking the information and explaining it in a way that's so simple that it's just like, oh, okay, that makes sense. I think a lot of times we, as healthcare providers, and as much as I try to make things simple, you can like break it down even better than I do.
Right.
But a lot of healthcare providers, they don't, because we're so used to talking to other healthcare providers,
terminology and all that.
Don't turn it down enough to make it like plain and simple. And I really pride myself on that, but you do it even better than I do. And so that's what it's about. It's about making sure that people understand the information to make good health decisions. That's what health literacy is. And that's what my passion is making sure that you know the information, but that you really understand it and can process it in a way that helps you make a good health decision. That's like all I want. And so, George, shout out to George Mink Jr., practitioner of the streets.
It's good like job. A testimony. It's like a testimony.
And then he'll tell someone else, and then he'll get someone else.
That's what he said, though. That's what he said. First of all, this brother ready to get hired. I said, I ain't in the hiring department yet, but this brother ready to be on board. But he did.
I love that.
He said he appreciated the information that I gave him. He said awesome. He knew it was real, and like I told him, I gave him my own perspective. Like, so you allowed to feel a certain type of way in the beginning. And you know, but as the information start coming up and you start doing your own research.
Yep.
So he said, you know, he thanked me for that. I'm like, wow, okay.
We always there. We always like,
Right.
But it's just getting the information, processing it, understanding it, and using it to make the best decision for you. And it could be to get the vaccine, it could be to not get the vaccine, but at least understand the information
Right.
and not just go based on how you feel. You have to go based, put the feelings in with the information together and then use that to make a decision. Not just, oh, well, I think it's going to do this or I feel it's going to do this. You got to use the facts. And that's
Right.
why we're doing this reset and we're getting everybody caught up so we
I'm
can.
working on my neighbor too. I seen him today. He's gonna try to get me for some Dorney Park tickets. See, that's what's wrong with black folks. So you're gonna get the shop for some Dorney Park tickets? Nah, bro. Like,
That's so funny.
no, I can get you some coupons. That's about it, bro. Come on, but nah,
That is hilarious.
It feels good though to get the information out, and just even being a black man, knowing how we laid on, just keep taking care of ourselves and
Yep.
and dealing with, even like we were talking about men's health. It's Men's Health Month.
Yep.
It's time for us brothers to step
Perfect
up.
segue.
So go ahead, Doc.
No. I was just saying it's a perfect transition to talk about Men's Health Month because we were, it is June, it is Men's Health Month. And so we want to make sure that men have information that they need to make good health decisions. And I want to do a show before the end of the month on men's health. So stay tuned for that. But one thing that we talked about, what about men's health did we want to share with everyone? Because it's so much and, we only got a little bit of time. So today we just wanted to talk about the fact that just because you may not have health insurance does not mean that you cannot access good health care. And there are so many places and clinics around this country that will provide care for people who don't have insurance. They were created to do that because the government knows that everyone doesn't have insurance. And so these facilities are funded by the state, local, and federal government. And they provide healthcare to people that have little or no insurance. And an example of that in Chester is Chest Pen.
Mm-hmm.
And we know that a lot of people feel like Chest Pen is a place you go to if you have like an STD or something, but they do so much more than that. And so we want to encourage our brothers to, if you're in Chester or anywhere else in Delaware County or anywhere really in the country, you can find facilities like Chest Pen all over. And Dr. Jones, could you put a link in the chat for FQHCs? I know that there's a link that people can put in their zip code and find an FQHC. That's a federally qualified health center. And that's what they do. They're all over the country. They're all throughout Philly. So she'll put that link in the chat. You can click there, put your zip code in. And men, don't use I don't have health insurance as an excuse, because too many of our men are at the top of the list, dying from so many diseases that can be prevented because we don't have access. Well, because we don't take advantage of healthcare that we have access to. So that can come to an end. That can absolutely come to an end. Look up an FQHC that's close to you and just schedule an appointment and go get your checkup. Just once a year.
At least do that. That's going to be the crusade I'm going to be on next, Doc. Getting brothers to just go get checked out. Mm-hmm. I'll have all the information for them. They can reach out to us even if they don't see it in the link or in the chat or whatever. See the link in the chat. And it's just time. I'm behind myself, so it's time for me to catch up. So while I'm promoting and advocating, and I'm gonna be doing it myself.
I was just about to ask you, when was your last checkup?
Yeah,
Thanks for coming clean. Thanks for coming clean.
It's coming up. It's coming up. And honestly, I was one of those people that felt like if I didn't have insurance, or if I didn't feel like, it wasn't that detrimental to go to the wasn't no real reason to go. So I never went. But that doesn't mean nothing is wrong.
That's true. A lot of times we don't find out that there's something wrong till we end up in the ER. And then we realize we got high blood pressure and diabetes and high cholesterol and all these other things, but we cannot afford to wait that long, because the thing is that if we wait till we get to the ER, that means that something emergent happened. So the idea is get your checkup now so
Right.
that you can find out what you're at risk for or what you may have, and you can treat it so that you don't have to worry about getting rushed to the ER for anything.
Right.
And
Right.
so,
So I'm on it. I'm leading a crusade, and I even start. I'll do a little bit of footage when I first go in there. Like
okay.
I'll get
Yes,
a little
please.
footage of me go there here and just be just giving y'all the face. But I mean, it's serious, and as we get older, we start getting more mental and professional in the mindset. So I mean, I gotta lead by example. So that's the most important thing. Anything I'm preaching, I have to be doing it myself. So
Yes.
I'm gonna lead brothers into that. I mean, once we start wanting to get into our families, want to enjoy our grandbabies and life and traveling and all that, we can't do that if we don't know if we're healthy or not. Like,
Exactly. And we're not going to be here to enjoy our families, our children, and our grandchildren if we're not healthy.
right,
So
right,
it's time to get healthy.
right, Doc.
Time
So
to get healthy. Um, so y'all heard George. He said he gonna go get his physical done. So y'all know I'm
I'm
gonna
gonna
be
do it, and I'm gonna just go
all.
live. I'm only gonna go live like till I get to the door. So that's after that. It's just all right.
It's private.
I
It's
might come
private.
back
Pull
out
the
and just,
curtain.
but if I go back live, then I'm good. If I don't go back live, then I don't know.
It's the problem.
But no, I am though. I really lead that crusade along with getting vaccinated. It's crazy because like this whole month, like I touched a lot of people, and I really didn't realize it. Like that a lot of our folks really had these crazy, weird thinking about. I don't know, like about getting it. Like they had this crazy voodoo spot. And I'm just like, no, 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 no. And I
Yeah, I
bring them the
know.
information. And like you was talking about the data, Doc. You was saying the people that got the one shot.
Oh
I
yeah.
mean,
Oh yeah. We talking about that.
right. I mean,
Yep.
what's up with that? You got one shot. So what's your perspective on that, Doc? If you got one shot, what's the deal?
So the problem is about 80% of people in the US have two shots. About 65% only have one shot. So
Mm,
if you only have one shot, you're not fully protected. Depending on which vaccine you have, you may be about 50 to 65% protected. So you need to get your other shot, and you don't have to, wait. It's okay that it may have been a month or 2 months or 3 months since your last dose. Just get the second shot and get the full protection that you need. You'll probably get better protection than a lot of us, because typically with vaccines, when you have um, and we talked about this last week, all vaccines require at least 2 doses. There isn't any that you just get one and then you're done forever.
mm,
Typically, when a vaccine requires multiple doses, you usually space them out by you space out the first 2 doses by about 8 weeks. With
mm.
COVID, we didn't have 8 weeks to be spacing out doses because too many people were dying. So when they studied it, they did it 3 weeks apart between the 2 doses, and it worked. And so that was great. But you'll probably get better, longer protection. I didn't look at the studies, but I'm just going by how the immune system works. You'll probably get a better response if you spread the doses out a little further than the 3 weeks.
Mhm.
So if you haven't gotten your second dose and it's been months, it's completely fine. It's time to wake up your body so that it can respond to the vaccine, create the antibodies that you need to protect yourself, and get you moving in the right direction. You're not all the way protected yet. Get your second dose, America.
Right. So,
So
Doc,
yeah, so
you
we
want
were
to go
also
in?
going to talk about. Oh yeah, go
Go ahead,
ahead, George.
Doc. I said, did you want to go into the 5 reasons why I still, the reasons why we came up, why I still, like legit to still get it, and the people that feel like it's okay that they
Mhm.
didn't.
Yeah, let's talk about that. I looked up the numbers this morning. So for Delaware County has had a total of about 120,000 cases of COVID and about 1,800 deaths. That's not a whole lot. So we're not talking about dying from COVID. There's a really low chance that a person will die. It happens, but it's a low chance. The problem with COVID is the long-term effects, like the long things that linger on, the heart problems, the lung problems, the brain issues, the vision problems, stuff. So because when the virus gets in and it starts attacking, it just starts attacking. And so you don't want to experience COVID having no defense at all. You at least want to have some defenses, and that's what the vaccine does. So we're going to talk about what are the top reasons why you should still get the vaccine. The first one, we already talked about that because you got the first dose. So now it's time to bring it home, close it out, get the second dose. You were fine with the first dose. You're not a mummy. You're all good. You didn't turn pink or green. Get the second dose and just seal that up, please. Please. And then, George, you want to go into number 2?
Oh, yeah. I'm just going to go off my personal list. My personal list is I feel as though we did the defense, of course, they have defense, against the variants or different versions of it. But of course, like it's your duty around other people, that people in your family, the elderly people that might not have the same immune system. So I kind of feel like it's our duty at this point when we know what it did to the world. It stopped the world. So go ahead, Doc.
I think that's a good point because it's not just about protecting you, right? So I got vaccinated to protect my son, who is 2.5. He can't get vaccinated yet. So I wanted to make sure that he got protection, because if I'm protected, then if I'm protected, his dad and his sister were all vaccinated. If we're exposed to COVID, we can fight it off much quicker, and we have a lower chance of spreading it to someone like him. And so you don't get vaccinated just for yourself. It's also about people that's around you who may not be vaccinated or who may not respond to the vaccine like healthy people do. So I think that's a really good point. It's not just about you. Now, while we're on your personal list, let's go down to number 3. What else you got?
I got since everybody on that be right back tip, everybody on that be right back. You traveling through the airport, like where millions of people come from all over the world. So who wouldn't want to be protected? I mean, that's where you're more susceptible to get it. You're traveling to other countries, you're traveling to other cities, you intertwining with different multiples of people. It's the summertime. I mean, these is just masses of people all over the place. It's hot. Everybody want to be outside. Yep. So why wouldn't you want a defense against something that's still alive? It didn't go away. We just eased up because people started getting vaccinated to the point where we're more comfortable, but it's still alive. I know people that just got COVID like 2 days ago.
Yeah.
But they were protected. So, I mean, the traveling folks, we all want to get away. I need to get away. I'm trying to plan one now.
Where are you going?
I don't know, Doc. Puerto Rico, Hawaii. I don't know. We need to go somewhere, where it's like palm trees and and ukuleles and stuff, and maybe
and flamingos.
Flamingos. See, you already know flamingos and just exotic animals and just coconuts and good stuff.
That's awesome. That's good. That's good. Yeah. So it's travel season, so we got to make sure we protected. You on a plane, you on a train, you in an automobile, wherever you are, there's people around and you don't know their vaccine status. So don't depend on other people to be vaccinated. You make sure you're protected so that you don't have to worry as much.
Right.
Really good point, because I mean, like you said, like the world's moving on, like nobody's wearing masks. It's just a little much. And poor Noah, this little boy, the only boy in his classroom with a mask on. But he keep it on though. Noah keep it on. He leaned in when the teacher tried to fix it. I said, that is my baby.
But it's okay. It's all right though. He get it honest and it's fine. I mean, it's crazy because when I see people with a mask on, I'm like, why they got a mask? I mean, it's just like, but I mean, I get
the reset button on you.
I know, right? I get it though. Listen, I understand it was a scare of a lifetime. Trust me. And some people really didn't buy into it, but I bought into the scare. But I just wasn't a mask person, even though I know we had to wear them. I feel comfortable just with being vaccinated and boosted.
Yeah, and
This
that's
is, I
fine.
have to wear a mask, I wear 'em.
Yep. And again, for me, it's just because he's not protected. And so
Right.
I'm still around, a little one every day that's not protected.
Mm-hmm.
So for people that have who are mostly around adults and people have all been vaccinated, if they have any children, they have been vaccinated. He's just in that age group where he hasn't been.
Right.
Now he'll get vaccinated. Hopefully they'll get this together soon. And I'm gonna do
Mm-hmm.
my little waiting period. And
Right.
then I'm gonna get him vaccinated. Now, if I'm still talking about putting a mask on him in like October, then y'all can call me something. But until then, don't judge me. Like
Right.
he not vaccinated. He got to wear a mask. He got to
Right.
get protected. So yeah. Now let's go into your next personal list item since
Okay,
we're on
let
your
me check
personal list.
because I had protecting the elderly, traveling. I mainly was saying like for the folks that's working, it would affect your sick day time. So say you got COVID, and got crazy symptoms, without the vaccination, the symptoms might be a little more detrimental. I mean, you don't know what to expect even with the shot. So without the shot, I mean, you got a worse chance of really like outcome, coming out with it so fast. So, I mean, it's just, I feel like for the working folks and for folks that, have to go out every day, even people that own their own business, you definitely have to be vaccinated. I mean, because that's part of your livelihood. You want to be protected amongst your peers, amongst your customers, amongst just your circle in general, or it would affect you. So even if it's your own business and you're sick, you can't run your business. You can't, it won't function if you're not if you're not around, or if you're sick, or if you're down, or if you don't have the right backup team. So if you're at a job, I mean, it's going to affect your sick time. I don't know how jobs are approaching the COVID deal now, or they giving
your sick time when you're sick. And if you don't have no sick time, then you're not getting paid when you're not
okay.
working.
Oh, well, so there we go. I mean, that's why I feel that's on the list.
Absolutely.
It's definitely on the list because it'll affect your livelihood.
Yep.
Yeah.
Absolutely. And that's a big deal. And that can be prevented. So what we're saying is ask your questions. Ask your questions to us. Ask your questions to your healthcare provider. If you want to walk into a pharmacy and ask a pharmacist questions, get your questions answered. But make a decision and don't just shut down the vaccine because of how you feel.
Right.
Use factual information to make a decision and stop believing what you read on the internet, because anybody can put anything on the internet. Anybody, I see the craziest stuff and I'm like, somebody is going to believe that.
Right.
Somebody is really going to believe that. And people can make anything up that they want to make up. You got to stop believing what you read on the internet. Stop clicking on stupid stuff.
Yeah.
Just keep scrolling past it. Keep scrolling past it because it's noise and it's trying to cause confusion and it's confusing our people. That's exactly what it's doing. And that's the purpose. And so y'all got to stop believing what you read on the internet. You got to find somebody that you trust who knows what they're talking about and get the information from them. It's so crucial because this is not going to be the last time that you got to make a health decision. It's a lot of health decisions that you're going to need to make, and new stuff is going to come up, and you need to know how to navigate, find information, get your questions answered, because it could be worse than this. And so this is already bad enough. We don't need anything worse, but you got to be ready. Whenever anything else comes up, you got to know how to get through the noise to make a good health decision. So I don't know if I can say that enough, but it's just crazy that when I hear people say why they don't want to get vaccinated, I'm like, they saw that on the internet. Like they saw that on Instagram.
Or they heard it and they went along with it. Because you have to do your homework. And again, like we both always say every week, it's been enough time for it to prove that it works. So whatever theory you had in the beginning, there's no way you still had the same theory because the information is there. That's why we out here telling our own folk. You're not hearing it from nobody else. You're hearing it from us. It works and it's going to help your livelihood. It's going to keep things going in your household. It's going to keep things going in your life. Like it's a part of lifestyle now. You have to accept it. You can't just downplay it and act like it doesn't exist. It exists. It's here. It's not going nowhere. And it's time for us to be vaccinated. It's like, come on. Like, we not going to stop talking about it. People say like, damn, ain't COVID over? COVID's not over, bro.
It's never, it's not
still
going
here.
I mean, we can stop
like
talking about
else.
it if people get vaccinated.
Right.
And it goes away. But let's just do a quick recap. Oh, real quick, the last thing that we wanted to share in terms of why to get vaccinated is just to protect yourself against whatever future variants is coming about. So we don't know what they are yet because the virus just do what the virus does, and it replicates and it mutates. So whatever else is coming, you get protected now to protect yourself in case it's the worst thing that we've seen yet. So just please get protected. So I want to do a quick recap. One, we said, because if you got the first dose, you need to get the second dose. Just go ahead and get it. Number two, the vaccines are our best defense. And it's not only about you. It's about protecting your loved ones, people that are around you. Number three, travel. I know everybody got somewhere to go. George about to go to some exotic Caribbean island. So, people out and about traveling. No one's requiring masks anymore. So the best thing you can do to protect yourself from COVID. And the last thing you want to do is be on vacation, get COVID, and get sick. Especially if you're in another country, you don't know what kind of healthcare they out. I don't even want to go down that route.
Right.
Next, if you have a job that doesn't give sick days, or if you don't have sick time, because you are an entrepreneur and ain't no entrepreneur have sick time, it's just your time. You can't afford to be sick. You have to do what it takes to protect yourself. And then lastly, you want to be protected against future variants and making sure that whatever else COVID got up its sleeve, you ready for it ahead of time. We need to be proactive and not reactive. So I just wanted to make an announcement about events we have coming up. I know when we was out in Yankee, people was like, well, when y'all come to Chester? When y'all come to Chester? Well, we coming to Chester. We come to Chester this weekend. We're going to be at the Tide One On for prostate and colon cancer. So again, tying back to men's health, come out, learn about these things. I know there's going to be some free colon cancer kits distributed. We're going to give out COVID vaccine tests, and we're going to be giving the vaccines. So come down to Subaru Park on June 18th. We'll be there from 9 to 11. We're also going to be in Darby at their Juneteenth event. That's going to be at the Rec Center. That is also June 18th. That's from 10 to 2. So I don't know how we're going to be in two places at one time, but we're going to let the Lord work that out. Right. I was thinking about doing a competition like Chester versus Darby. How many, who going to get the most vaccines?
I don't know, Doc, but okay.
George, what you think?
I don't know about that. I'll just be happy everybody win if somebody get vaccinated.
No, we're going to do a competition. Who is going to win, George?
I don't know. I'm just saying, you want to have to offer something. You know how folks, you got to put something on the line.
I got to get something to the whole city?
I don't know. You might. I'm just saying, our folks, we hard folks. So it's
just a friendly competition.
Right. I don't know. We could put it on. It could be a wager between both of us or something. You know what I'm saying? Because I've been working both sides. So
that's true. So you kind of biased.
Yeah,
you really biased.
I mean, I know I got folks, down the way. So they.
All right, I don't want to put you out there like that. So I'm gonna just go with Chester because I'm from Chester. So I'm gonna say Chester gonna win this. Chester versus Darby. Who gonna do the most vaccines on Saturday? So that's my wager right there.
Right. But everybody come out, enjoy. Some good brothers putting something together. Something I feel as though is well overdue. The awareness is major. It's Men's Health Month. We're going to keep going and turn it into Men's Health Year.
Yes, Men's Health Year. Let's do it.
Right. So appreciate all y'all good brothers on the front line and sisters. Doc, I appreciate you, of course. Thank you for the platform. And all we're doing is just trying to help people make better decisions. That's it.
That's all. That's all. Just want to give a shout out real quick to Miss Mayfield and Tyrone Riggs, Tent of Life is in the building, and Haley. Hey, Haley. So thanks everybody for tuning in.
Tent of Life. What's going on? What's going on? What's going on, everybody?
Yep. So just as always, if anyone has questions, you can always reach me at 267-322-0470. Thanks everybody for tuning in. We will see you this weekend.
Yeah. Thank you, everybody. All right, Doc. Have a good one.
You too. See ya.